Today marks World Cancer Day, and cancer is regarded as the second leading cause of death globally. Now, low-income nations are battling to train oncologists who treat cancers, and several countries in Africa can only boast of a few. Another challenge is the brain drain syndrome, which is taking these medical professionals out of the shores. Our correspondent, Jacqueline Ogo, reports.
Statistics given by Globacan, an organization that gives details of cancer spread across the world, says in 2022, 124 cases of cancers were recorded in Nigeria, and of that figure, 70,000 people died in the same year. The organization also says between January and the few days of February 2023, 10,000 cases of cancers have already been recorded in Nigeria. That is why public awareness campaigns are getting more aggressive to ensure people stay within the lines of safety. Nina Ibikunle is an obstetric gynecologist who advocates against breast cancer. She tells how to stay safe.
If you've been having breast lumps, there might be a need for you to be wary, just be a bit more cautious. And then when you're past 35 years, make sure you do your routine mammogram. Self-breast examination majorly is also very important.
An oncologist, Mabadeje Isowo, who treats cancer patients, is worried about the payment for treatment, which comes very expensive. She says more lives can be saved if the government subsidizes the payment for treatment.
They pay out of pocket, and it has been a burden to them. And another thing is that they should also consider anti-cancer drugs will be under NHIS. It's going to go a long way in cancer management, sincerely. Early diagnosis and instituting treatment immediately is still the best.
The Minister for Health, Osage Ehanire, says the government is already taking crucial steps on offering support.
There's a cancer access program that the government is organizing that pays 50% of the cost of treatment. So many people can now better afford that. And then there are also other international NGOs that are contributing also to further reducing the cost.
As the government seeks cancer care solutions, many say the tariffs for the importation of medical equipment for its treatment should be waived as one step in the right direction. Jacqueline Ogo, TVC News, Lagos.
And for more on the World Cancer Day, let's speak to a Senior Special Assistant to Ogun State Governor on Health Matters, Dr. Ololade Kehinde. Thank you so much for being a part of the news 10 this evening, sir. So, but let's get this matter straight now. According to the World Health Organization, we understand about 1 million Africans may die yearly by 2030 if there aren't any urgent and bold intervention. Now, what do you make of this?
Well, thank you very much for this privilege. It's obvious that majority of those statistics come from the cancer registries that we have in Nigeria. We have a few of them dotted around the country. And obviously from those, we realize that the largest killers from cancer is the breast cancer. Also for the men is the prostate cancer. For also closely following breast cancer and the females is the problems with cervical cancers. So we realize that those that have early detection, they actually do well. But majority of our patients present it for so many factors of limited access to healthcare, inability to afford diagnostic equipment and tests, and also the cost of treatment.
And it is also understandable that the continent has only about 3% of cancer treatment facilities, with the likes of radiotherapy available in about 22 sub-Saharan African countries. But what can be done to scale up the availability of cancer treatment facilities?
Well, for us to have early appropriate treatment, we have to ensure that majority of our patients can gain access to radiotherapy machines for treatment. It will amaze you that in Nigeria, we have less than 10 that are functional. And even of those that are functional, we have a whole lot of people that have to travel for as much as 100 to 200 kilometers. Some people in the private space, some people in the public space have tried and are still ongoing with increasing